Hello. Today I will present and I will talk a little bit about the analysis of organic acid in carbon. This is a test that is quite commonly ordered for children from ASD spectrum. I will try in this presentation to try first of all why it is important to have nutritional testing with these children. I will talk in more detail about the very test of organic acid. And I'm going to dedicate a little bit the attention to different parts and to say why each part is important of this test. Today we are being listened by professionals and parents both, and I will try to speak in the most simple language possible. I will also try to explain what we see most commonly with children of ASD regarding the result. Is there a trend that there is commonly seen? Of course, every child is special and individual in themselves. However, there are things that are quite common. Finally, what is the information that this test provides us with? However, before we start talking about the very test, I would just like to explain a little bit more about the functional analysis and the traditional analysis that we have in the laboratory, such as when we directly analyze an analyt. Well, direct measurement of a specific analyt is when we decide a specific metabolite from the sample of the patient himself or herself. A good example would be vitamin B12 serum or different types of acids. These kinds of tests actually see the types of analyts in the very material of that serum, as opposed to the functional analysis. We can here identify cellular needs for specific nutrients, taking into consideration numerous biochemical pathways that are dependent on that specific nutrient that is cofactor of it. Let me give you an example. For example, an organic acid from the urine is called Methylmalonic acid, which is Methylmalonic acid, which is widely known to most doctors. This is actually a product that is created in huge amounts, especially when there is a functional deficit of the vitamin D. Before the very deficit in the serum of vitamin D, we can actually see the deficit of the methylmalonic acid in the urine. This can, of course, help and independently from the deficit of this level in plasma, but in methylmalonic acid, it can have a deficit. So which can actually lead to the idea that there is a deficit of the vitamin itself. Therefore, by analyzing these pathways, the test of organic acid, it can lead to nutritional deficits depending on the cellular level necessities. Now, the next thing that is very important about nutritive testing is that many biomarkers in the test allow information of the nutritional needs of the patient, and they can also have a direct clinical application by indicating to specific needs or the process of the states of the diseases. I will give you an example. For example, the famous quinolic acid. Somebody mentioned it today. It can indicate potential problems, for example, for the vitamin B6. However, it can also indicate that this organic acid, when it is elevated in elevated level, it can indicate that there is an inflammation or any kind of neurotoxic state, which can be seen in many different examples in many different diseases. I will talk about this a bit later. Therefore, the more we know and understand functional nutritional tests and analysis, we can understand more their role in chronic diseases on the cellular level. The last thing that I would like to talk about also is the possible influence of the supplement on this test, that there are some influences. Patients are usually advised that before 48 hours before they actually give a sample, that they should not give that they should not have any supplements that have specific vitamins such as C and B, in order that we can have a valid sample. However, some doctors actually advise their patients to continue with taking supplements so that they could actually see the results of the nutritionals. For example, if they are going to retest themselves, they want to see what happened in the end. So organic acids are specific components in the urine that are actually parts of the urine. So therefore, the level of these compounds in urine can indicate that there are actually these micronutrients for critical enzymes that are necessary for metabolic pathways. Therefore, dysfunctional and insufficient enzyme activity in this metabolic pathways can produce enzymatic block, which means that organic acids that have preceded in this enzymatic block can be accumulated and spill into the urine. Therefore, we can see which nutrient is responsible for this block and therefore why this organic acid is in an elevated number in this urine. Traditionally, urinary organic acids are assessed and measured in neonatal pediatric medicine in order to identify inborn errors of genetics, in genetic inborn errors of metabolism, with severity depending on the degree of type of error, depending on the metabolites. In many cases, the genetic inborn errors, the enzymatic defects can actually be compensated with high doses of specific vitamin and mineral cofactors, or with dietary interventions. These metabolic pathways can be compromised in some other ways, so it not necessarily has to be a genetic error, so it can be brought by common lifestyle, therefore by dietary habits, the nutritional deficiency, toxicity, bacterial overgrowth and causes of bacterial that can be shown by this test, which usually is shown itself from the GI, gastrointestinal tract. The drugs also that we can take also can influence our mood swings, mood disorders, fatigue, digestive complaints, and of course weight losses.
Now we're going to look at the organic acid test itself, and you'll just have before you the first pages of the report. Here we've got a nice graphic display of the test. At the bottom of this page you can see 3 functional pillars that we're looking at. So looking at all the markers that are being measured in the urine, certain algorithms are applied for calculation, and we get an index of the mitochondrial dysfunction, if there is a need to support the mitochondria. They are obviously very important for the energetic metabolism of a cell. Toxic exposure, the need for antioxidants, and therefore the need for nutrients which could help to bring down the burden of toxins. And of course the most important one is the need for methylation support and the methylation imbalance in order to provide the best possible methylation. Page 2 contains a display of what, using this algorithm, we get nutrient needs based on all the analyts which have been measured in this sample. And this is just a suggestion, of course. The laboratory does not have the idea what sort of patient they're dealing with, and the doctor is there to modify and adapt this according to the patient history and his or their state, which supplements and if any supplements are going to be prescribed. Next page, you have several pages such as these ones in the report, and they show you the a summary of the general needs for each nutrient, and they are more educational and are important for the patient because they point to the level of importance of each nutrient and where these nutrients can be found in which particular foodstuff. Now, this is how the whole sample and findings look like, but we'll obviously go into more detail later on. The organic acid test is divided into several categories. We've got here the main categories of malabsorption and gastrointestinal tract dysbiosis markers. This is an important segment, especially in ASD children. Then we've got cellular energy and mitochondria markers, vitamin markers, neurotransmitter metabolites, because in this test we measure the metabolites, transmitter metabolites, toxic and detoxification markers, and oxalate markers, finally, at the end of the day. So we'll talk about it in more detail, but we'll first take a look at the malabsorption and dysbiosis markers. Malabsorption markers point at the potential malabsorption of protein, amino acids, and if, for example, the amino acids are inefficiently absorbed in the gut, they are then metabolized further on. And you can hear the androlactic acid and phenolatic acid, and we're talking about the acetyl acid all together. Now, we've got here dysbiosis markers. They are an important segment here. They are the products produced by the bacteria in the digestive tract, and so if there is a higher level of them, we can suspect that there is a problem at the level of the colon or the digestive system, but we need to make sure that if one isolated marker is high, doesn't mean that it's a case of dysbiosis, because the same bacteria living in the gut metabolize phenols in the food, contained in the food that we eat, and can also produce some of these metabolites. So, for example, the patient has eaten quite a lot of red fruits, chocolate, some of these parameters may be a bit high, but we need to know how to look at these findings, because if several markers are on the high, we need to suggest to the patient that they need to do a more detailed stool sampling and analysis in order to determine if there is a presence of dysbiosis or not. The last one is the yeast of fungal dysbiosis markers, which refer to the fungal dysbiosis in particular, because in children in particular we find a higher presence of fungi in their digestive system. And arabinitol is a very specific marker that can point to the presence of fungi. Now, we can't look at this in isolation, because if there is a higher percentage of fungi in the gut, we need to ask ourselves why they are there, because if the child is constantly presenting with the same findings, because the fungi are the result of or a response, the response of their immune system. So if their immune system is slightly weakened, the fungi will, of course, grow and flourish. So we don't need to sort of fight the fungi, because I've dealt with a number of children who are all constantly taking same medication, which is not sorting the problem out. So we need to go a bit deeper, go to the heart of the problem and see why this is happening at all. This is something that's providing the information, but then we need to look at the reasons behind it. Cellular energy and mitochondrial markers and cellular energy metabolism are listed here, but this is in the test itself. There is a page that is very picturesque and shows us who've studied medicine and these areas in particular. We are very familiar with this, because this is something that we've learned in secondary school, the Krebs cycle display of metabolism, and here you can really see this particular bit, which is very important, how mitochondria, the most important organella in our bodies, responsible for the for energy metabolism, how it operates. So this is why I have to point out that in this test we look at in the carbohydrate metabolism section, we see the presence of ketone bodies such as hydroxybutyric acid or beta-OH butyric acid, and in case the levels are higher, they'll point to a slightly weaker carbohydrate metabolism. Also, I'd like to add that, hold on a minute, vitamin markers are and another very important segment of this test, because they tell us quite a lot, they provide us with a lot of information. We've got this first section which points to the markers of branched chains of catabolites, which will show us the need for B1, B2, B3, ILA acid, the methylation markers, folic acid, methylmalonic acid markers, and finally the biotin markers, which point to so B7 vitamins, which will point to the need for the presence of vitamin B7. So further on, the metabolic pathways of organic acid, which were shown in the report, and I don't have them here in because there's loads of pages in my presentation. They give us a better understanding of how these analyts are linked to the needs for vitamins. So I'll go back to methylmalonic acid. So you can see that this metabolite, methylmalonic acid, is circled in red. So you'll see the methylmalonyl as an enzyme, A enzyme, is transformed into, with the help of B12 vitamin, is then transformed into succinic acid. So this is a methylmalonic mutasis, enzyme mutasis. And so if we do not have the sufficient presence of vitamin B12, the methylmalonyl coenzyme A will simply turn into methylmalonic acid, which means that we'll have a high presence of it in the urine. Next scenario that we're looking at, I'd like to just apologize if you could keep it a bit slower, because it's more important for the interpreters to interpret this. No, it isn't. It's not. It's fine for the interpreters. So the same goes for this scenario. You'll see FIJ-GLU, that's a formiminoglutamate acid, that's an abbreviation for it, which also depends on folic acid. And if we do not have the sufficient presence of folic acid, the FIGLU will be deposited in the urine. Also alpha keto acids, which are shown here, the same goes for them, which are markers for some other vitamins B, such as B1, B2, B3. Now, here's a table showing you the neurotransmitter metabolites. It's very important in children on the spectrum, and something that I'll talk about in more detail is the kynurenine markers. So here we have in this section, we've got the kynurenine markers that are linked to the metabolic pathway of amino acids, tryptophan amino acids. As you can see here in brackets, these metabolites point to the need for vitamin B6. Now, kynurenic acid will be transformed into kynulinic acid, so-called, which I have to say is very often at a higher level among the children on the autism spectrum. The higher level of quinolinic, this one, quinolinic acid, not many studies have been conducted with children on the autism spectrum, but we have some information that frequently the quinolinic acid levels are higher in persons with schizophrenia, depression, even people with Parkinson's disease, Huntington's disease, and also in some viral infections. So this is a marker for neurotoxicity, but also for the presence of an inflammation of sorts. Now, the higher level of quinolinic acid is believed to have an excitational impact on the neurosystem and in the in conditions where there's inflammation, even the inflammation of the brain. But what is particularly important to say is that this ratio of kynurenic and quinolinic acids, the ratio that I'm showing here, is also quite important to keep it in the green zone, because when this ratio is low, it can then be pointing to the general neurotoxic condition, because the kynurenic acid has the opposite effect of quinolinic acid, and it neutralizes the negative effects of quinolinic acid, so to speak. So among the children on the autism spectrum, we often see this low ratio and the quinolinic acid level is high. It would be interesting to study why this is so, but what is very interesting is that we know that vitamin B6 in these cases can help quite a lot, and in my practice I've seen that we can lower these markers to some sort of acceptable level, which is the whole point of this test, in order to tell us what to do. So the catecholamine markers are the products of dopamine, epinephrine, and they're often used as indicators of the functional shortcomings of certain cofactors, vitamins and minerals, and so on. Many doctors use this analysis in order to look at the catecholamine situation in their patients. Then the next one is the serotonin markers. We're looking at 5 oxyindolylactic acid. So that is the product of serotonin. We often see higher levels of this in people who are on antidepressives, such as SSRI, selective inhibitors of when you take additional quantities of serotonin, or in PHTP supplements. We need to bear in mind that 90% of circulating serotonin is produced in the gastrointestinal tract. So, in other words, serotonin definitely encourages the mobility of the intestines and can also be higher in IBS dysfunction and irritable bowel, especially with sort of more liquid stool in certain patients. This is often the case among children on the autism spectrum. Now, the next segment is the segment dedicated to analytes, which indicate the presence of certain toxins based on certain metabolites, which we measure here. So if we look at pyroglutamic acid, the first one on the list, pyroglutamic acid is the product of recycling glutathiones in the cell. It's very important for natural detoxification, for the second stage of detoxification in the liver. So when the glutamate is higher in the urine, then it can point to the need for glutathiones. But it's always good to do a parallel look at in parallel do the situation in a paraglutathione, because a higher level of paraglutamic acid will point to the need for precursors of glutathiones, such as cysteine, glutamic acid, glycine in particular, but B6, magnesium, which are also important cofactors for the synthesis of glutathiones. Now, the next interesting thing is the ketophenylactaic acid. When the levels are higher, it could be an indication of a long-term exposure to petrochemicals and plastics. So we're talking about styrene, for example. So there's a long list of things that contain styrene, such as plastic bottles, plastic boxes, and so on and so forth. So people with higher levels of this need to avoid contact with plastic. So when you come from the market or from the supermarket, you need to take all your fruits and vegetables out of the plastic bags and put them in a paper bag or the fridge. But sometimes it's impossible to avoid the plastic because of the environment that we live in, but we need to encourage naturally our metabolism to detoxify and fight the toxins as much as possible. Of course, the children there are at the greatest risk because they're small, their organisms are not strong enough, and the environment doesn't help. The next metabolite is MTBE metabolite. I'll use the acronym for it. It's the additive which is used in motor benzene, and in certain countries this substance is banned, but unfortunately it can still be found in around us. Orotic acid, apart from being present sometimes in very high quantities in urine samples of people who are suffering from illnesses which also entail certain metabolic disorders. The orotic acid can also be found in people who have been exposed to certain toxins, especially certain medication that are heavy on the liver, in alcoholism, etc. We don't see this in children very often, but these are some of the parameters which can be a bit higher. Now, oxalate markers. Here we look at the glyceric acid, glycolic acid, and oxalic acid, and oxalates in general. So what glyceric acid, when we have a higher level of it in the urine, it's very high levels in the urine, this can point to certain inborn errors of metabolism, but it's only a slightly higher level. We often come across this among people with rheumatoid arthritis, and the literature will tell you that it's also present in certain bipolar disorders, schizophrenia, that glyceric acid is also high, but the bad metabolism of this acid can be due to functional needs for vitamin B3 and magnesium, which are very important for its metabolism. Glycolic acid, apart from being caused by inborn errors of metabolism, it can also point to the presence of oxidative stress and the functional need for vitamin B6. Same thing goes for oxalic acid. Now we're going to go to now the interesting bit of my presentation, I'll talk about a case study of a boy of 7 years old who's been diagnosed with pervasive developmental disorder. And I use him as an example because I don't have that many examples where we did pre and post testing, because this test has the way this test looks has been changed recently, so I didn't want to mix the old and the new form. But this patient came, the mother brought the patient, says this diagnosed with pervasive developmental disorder, was poor verbalization, in a very supportive home with his mummy and daddy, younger brother. They all take care of him, surrounded by love, all things that are important, but he attends a preschool, kindergarten with his own assistant, somebody who works with him, and has 2 times a week visits the speech and defectology therapists. When they came to see me, they had very high problems with his diet, very picky. He was a very picky eater, doesn't eat either fruits or vegetables, and will only eat minced meat, biscuits with milk, and loves all sorts of pasta. The mother says that it's got regular stool, but that sometimes it's fairly loose, and the mother hasn't pay too much attention to that. I recommend that we run the basic lab work, such as the general things: CBC, urea, creatinine, ALT, ASD, the liver enzymes, TSH. Why do I love these analyses? It's very important to look at the liver and kidney function. And so if you opt for a particular therapy with supplements, it's important for all this to be in order first. And recently we've started looking at the TSH of, so we can, sometimes certain tests will point to a higher operativeness of the thyroid gland, and often looking at the levels of vitamin D, because sometimes there's deficiency in vitamin D, because 70% of the Serbian population has vitamin D deficiency. So we looked at the stool test. We did a slightly more detailed analysis of the stool, so some introduced in the Beo-lab. So stool test with dysbiosis, where the microbiologist will have a closer look at the stool. So copper culture analysis, but we look at whether there is a presence of an increase, not only in the fungi, but also other possible enterobacteria, which normally exist in the gut, and if there is a presence of dysbiosis. And finally, we did the organic acid test from urine. So what did we get? The organic, the CBC and biochemistry were normal. Stool analysis was okay. So we looked at the
So we actually see everything normal. The vitamin D was 35 millimoles per liter, and then we finally did additional tests where we finally saw that the candida was present. And now let's take a look at the test of the organic acid. Let's take a look what we've seen here. As you can see, there is a dysbiosis. Everything is normal within the normal limits in dysbiosis markers. However, here the D-arbutinol in the fungal markers confirms actually that there are some fungi in the stool, which we already know. And the other side, we have vitamin markers. They are quite elevated here. Definitely when we see this, even by glancing at it, we can see that the vitamin is quite B vitamins are quite here problematic, as well as methylation markers such as Immunoglutamic acid and Methylmalonic. The folinic acid is folic acid here was quite elevated, and then biotic markers here were quite elevated, which show that there is a need for a serum. Now, we need to go back to the fact that the child has restricted, that is, this child doesn't have a various diet, so this can be a cause of his or his nutritional deficiency. However, in practice, we can see children that have really good dietary habits, but they often can have disturbed markers here, and it's deviation, so we can see this quite often. After this, the fatty acid metabolism, as we can see here, these are the ones from carbohydrates. A lot of them are quite elevated in numbers. In the case of this child, this can be caused by not eating too much, and this so-called starving can lead to the increase of ketonic bodies in the urine, which can be one of the reasons for this. Now, energy metabolism is quite disturbed as well. B vitamins are crucial for these vitamins, despite coenzyme 10. Now, is no wonder that these results are such as we can see them. Now, here we're going to see some of these other markers. Now we have quinolic acid quite elevated, and this ratio, which should be high with quinolic and quinuric acid ratio, is changed and low. So this is quite often and commonly seen, and it would be interesting to investigate why, but I think that we can guess at the answers to these questions. Now, these catecholamine markers are in a normal ratio numbers. However, the serotonin markers are quite a bit changed. They are elevated, so as mother said, that there are liquid stools. This can be said that with this child, they can have these kinds of bowel that is problematic, and it is not something that is not unsolvable. However, we need to find an approach with digestive tract as much as we can, and to see what eventually we can do from these results. Now, MTBE, detoxification markers, as we can see here, that can be found in gasoline as well, is quite elevated. It's not that common because this family lives in the very center of the city, so this can be often seen with them. So let's see what actually happened. So what were the interventions that we did? Now, the intervention that we usually do for the following 3 months, after these 3 months, after the checkups, that usually does not involve tests, but it's actually just a checkup where we decide what to do next with the conversation with the parents, and then we decide what to do next. Now, the retesting is usually done after a year. Now here, pardon me, here I tried to aid mother, to help mother to include as many healthy options as possible. Now, this is quite difficult with the children from the spectrum because they have sensory difficulties, so they have actually different tastes and they experience food differently. Now, since this child prefers minced meat and some porridge, this child actually managed to, using some kinds of smoothies, and to impose some kind of meals that included vegetables and fruit. Now, this went easily since it was quite sweet in taste. Now, we included some kind of powdered greens that included some green vegetables in them. Now, I can't say it was quite difficult. However, this persistency of the parents and the work that we did together managed to help us achieve some kinds of results. Now, they found their ways to do this. However, it took some time. I think they told me it took 3 weeks. However, this persistency really was worthwhile. Now, they excluded, of course, sugar. Whenever they wanted to use any kind of sweets, a mother used stevia or erythritol, which is quite a better version than the classical white sugar. Now, we also made supplementation that was a multivitamin mineral formulated especially for this child by prescription, which find that this was the best option because parents then wouldn't have to find from different kinds of purchasers and to order from different kinds of purchasers these kinds of minerals. So it was the easiest option to put them together in one mineral. This was a fantastic solution because these are the capsules that can be opened and that can be injected by a syringe to the patient, to the child. Then we introduced fish oil, and I always pay attention to that fish oil actually has minimum 500 milligrams of DHA, which has anti-inflammatory effects. So we watched that we paid attention that this actually should have 500 milligrams minimum. Now, another thing that I like to include is that we change different kinds of probiotics every 3 months because of different biocultures. Now, I also told them they should turn to pediatric because of Candida. However, my opinion is that Candida can be regulated by probiotic and exclusion of sugar. I believe that any kind of medicine is not necessary to be given. In this case, anesthetin wasn't given, so they actually did the same thing. I also suggested that they should be bathing in Epsom salt 3 times a week. This Epsom salt can be bought for any kind of pharmacies. This is a sulfate, magnetic sulfate, which is quite important because of this. It's quite important for detoxification, and it has an ability to go through the skin to be absorbed via skin, and this is a natural way to incentivize the body. So this is something that we did for 3 months. After 3 months, we had a checkup, and I'm going to show you the results after 7 months, because parents were quite impatient to redo the analysis, and we did that after 7th month, and we achieved fantastic results. And I have to tell you that usual results by nutritional measures can be seen clinically and by parents, can be seen by specialists taking care of the child. However, I'm a biochemist, and I always like to see what is seen on the chemical level. Therefore, after 7 months, you can see that the arabinitol, which is still quite high, has fallen. B vitamin has been returned to the normal number. That supplementation that the child has been taken has had the effect, or proper the effect, that these metabolites are returned. As well, this form FIGLU acid is changed, and the folinic acid is also being improved. So we can see that all of these numbers have improved significantly, as well as the fatty acids and different kinds of acids were changed, as well as energy metabolism has also been improved. The thing that is quite important for me is the quinolic acid, which has fallen, as well as the ratio between the quinurinic and quinolic acids. So this is something that has shown to me that the good results, though we haven't measured any kind of oxidative stress. Therefore, even the serotonin marker has fallen, as well as other markers of toxins. With the child, we can always see some kind of a progress. I have the aim that every kind of disbalance is returned to proper balance, like gastrointestinal problems, and that the digestive tract should be returned to normal, and that the health, well-being of the child is improved, and that the maximum is taken out. Therefore, the goal of this biologic, or whatever we can call this therapy, is that the child, in the end, when they go to specialists, that they should and would have a sufficient focus, and that they don't have any kinds of distractions. Therefore, we always see progress. Rare are the cases where we can see any or no progress at all. This is all from me. Now I would ask for any questions if you have them. If not, you can ask them via email. Dear Milka, I have to admit that this lecture was one of the more interesting ones in the Congress, because I'm myself biochemist, because this has shown that the laboratory aspect of the laboratory is there to complement the whole picture and to help to give help to specialists, to other specialists, to the medicine staff, so that they can actually give some kind of a diagnosis and to complete the whole story. Considering that this kind of a test is specially test of laboratory diagnosis, these kinds of analysis is to a layman confusing, because they just see colors. In which ways can a parent or anybody who has seen that they can do this test in a Beo-lab, how should these people find out if this test is proper for them? Is there any way that we can find out that a person is valid for this kind of a test? Yes, this is a good question. So definitely child who are picky eaters are definite candidates. However, even those who aren't can, with children, we can often see some kind of metabolic dysregularities that can be the essence of the very problem. They can go hand in hand with autism as we talked before about neurotransmitters. So this is definitely analysis, like Dr. Nazi said, is a basic analysis. However, 99% of children should do this kind of a test. So, however, what to do in the end with this test? Somebody has to interpret it. Therefore, we need to find a doctor that can analyze this test and that can give you advice about what to do next. So, the goal or the aim of this Congress is that as many professionals see this, is that they get educated and that they accept this. This is not a diagnostic test. These tests do not diagnose anything. However, they give us some kind of guidelines about what to do next. So first of all, in order to avoid any kind of supplementation given off the cuff, we just, let's say I have had many experiences of children and parents coming to me with a huge list of supplements that they are taking. So they heard from different kinds of parents some kinds of supplements, and it is quite unnecessary. So then in the end, you have a child that with hyperactivity, and you do not have any idea what is the reason behind this. Therefore, you shouldn't do anything by heart or blindly. You shouldn't give your child anything, any supplementation without any kinds of analysis. So first of all, just do analysis and see what takes you next. So my second question is connected to the first one. So after the test and after we have gotten the results, so you're the person who interprets these kinds of tests. So you mentioned how important this individual supplementation, this kind of approach is important. So that we shouldn't purchase a bunch of vitamins and that this is a type of individual therapy. So you already mentioned this, and if you can just mention one more time, how much can this kind of therapy improve metabolic condition of every patient? Are you thinking about supplementation? Yes, well, absolutely. You have seen the slides and this child in particular, so before and after, from the metabolic point of view, is undoubtedly he has undoubtedly reacted positively to the therapy of supplementation, especially this child. I think it makes sense, definitely. This is pure science. It's nothing, it's quite clear. Thank you, Milka.